Hey, A&P students. Today we are talking about the cranial nerves. So there are 12 pairs of cranial nerves. They have names, they have numbers. You can see them all right here. We're going to learn their names. We're going to learn their numbers. We're going to give the major function of them as well. So these are all nerves that emanate from the brain. And not surprisingly, most of them are going to deal with stuff in your face, your head, your neck. There's one exception to that, more or less, but most of them deal with the head and the neck, which makes sense because they're coming out of the brain. So we see them here. We got the olfactory nerve is number 1. The optic nerve is number 2. Oculomotors are number 3. Trochlear number 4. Trigeminal number 5, abducens number 6, facial number 7, vestibular number 8, glossopharyngeal number 9, vagus number 10, accessory number 11, and hypoglossal number 12. Now, a good mnemonic device to try and help you remember all these names in order is this one right here. Old Opie occasionally tries trigonometry and feels very gloomy, vague, and hypoactive. This one works really well. There are others. Some are more memorable, some are less memorable. Find one that works for you. Another mnemonic device I like is over here. Some say marry money, but my brother says big brains matter more. What this tells you is the basic function of the nerve. So like nerve number 1 is the olfactory nerve. And notice the word here is some, which starts with an S. Nerve number 2 is the optic nerve, also S over here. So those two are sensory. Then the next two are oculomotor and trochlear. And so I have M's over here. So those two are motor nerves. Then number 5, where I have trigonometry, is trigeminal. And that one has a B over here, so it's both sensory and motor. So this is a good way to remember that general idea. Is it sensory, is it motor, or is it a combo of the two? All right, starting off, we are doing number 1, the olfactory nerves. So you got your olfactory nerves. They're going to start in the superior nasal cavity. This is where you're going to find odorant receptors. So molecules diffuse into your nose and bind to receptors there. It's kind of interesting. Every time you smell something, smelling is a particulate thing. So if you're smelling something gross, it means a part of that thing literally went into your nose and grabbed onto receptors in your superior nasal cavity. Now, the olfactory nerve filaments run from those receptors in your superior nasal cavity up through the cribriform plate of the ethmoid bone. Remember how we had olfactory foramina there? And then they're going to synapse in the olfactory bulb. And then from there, messages travel via the olfactory tract to the olfactory cortex. So obviously olfactory, that's smelling. Smelling is one of your basic senses. This is a sensory nerve. Okay, we got one down. Let's keep on going and do another. So number 2, the optic nerve. Each eye has an optic nerve. Starts in the back of the eye in the retina, travels through the optic canal in the sphenoid bone. We see the optic nerve coming back here and coming back here. Now, the two optic nerves meet in the optic chiasm. Some fibers are going to cross over, but then other fibers are going to stay on the same side. The medial fibers cross over, so medial crosses over. The lateral fibers stay on the same side. Now, once the crossing over occurs, we then have the optic tract, which is traveling back to the thalamus. Remember, the thalamus is where we sort and filter incoming sensory information. And of course, with a name like optic starting in the eye, this is a sensory nerve. Now, what's going on here with this partial crossover? Well, because of this fact that only some crossover, only the medial guys cross over, you end up with a sort of contralateral field. So if you were to look right now, if you were just to like stare straight ahead, everything in your left field of view, so if you imagine a line like from your nose out, so everything in the left field of view goes to your right occipital lobe of your brain. Everything in your right field of view goes to your left. But those fields of view, both of them involve the two eyes. So we have crossing over. So we want the right field of view to end up on this side here. And same thing over here. So we have a partial crossover, partial staying on the same side, and it gives us contralateral fields of view. So it's not quite like touch, whereas if I smack my left arm, it's my right parietal lobe that gets that. So it's a little bit wackier. All right, optic nerve starts the retina through the optic canal of the sphenoid bone. Optic chiasm, medial fibers cross over. Optic tracts take info to the thalamus, nuclei there, filter and sort. Then we send those signals onward to the visual cortex, which we know is in the occipital lobe. Okay, guys, we got 2 down. Number 3. Number 3 is our first purely motor one. So optic and olfactory were both sensory. Number 3, oculomotor. It's got motor in its name. Literally, eye mover, right? Oculomotor. And it is going to have both somatic and parasympathetic fibers. So both somatic and parasympathetic fibers. The somatic ones are going to go to some extraocular muscles. What I see right here is 1, 2, 3, 4, 5, 6 extraocular muscles. So muscles that are just outside the eye that help move the eye. The oculomotor nerve is going to go to 4 of those extraocular muscles. It's going to go to the medial rectus. The medial rectus muscle is going to be the muscle that is going to let your eyeball look inward towards your nose. Then the oculomotor nerve goes to the superior rectus. Superior rectus, on top of the eyeball, lets you look up. Then your oculomotor nerve goes to your inferior oblique. So your inferior oblique muscle, which with a word like oblique, it tells you it's going to be at an angle, whereas the word rectus over here is going to mean straight. Now that inferior oblique muscle is going to let your eye move kind of like up and out. Okay? So the 4th extraocular muscle is this guy right here, the inferior rectus. It's on the bottom of your eyeball. It's going to let you look down. So these 4 muscles, the 3 recti, medial, superior, and inferior, plus an inferior oblique, are all innervated by the oculomotor nerve. And these guys are all skeletal muscles, so it's somatic fibers that are doing that. Now, there are other somatic fibers too. There are other somatic fibers as well. There is also a muscle called the levator palpebri. palpebrae refers to your eyelid. Levator, what do you think that means? Is it going to make the eyelid go up or go down? Levator, elevate, right? So it's going to make the eyelid go up. If this muscle doesn't work, you can get a little bit of droopiness, as we can see right here. So those are all somatic ones. So we had the extraocular muscles, the 4 of those, plus the levator palpebrae. Now, there is also a muscle that we see at work right here. You shine a bright light into your eyeball, your pupil is going to constrict. There is a pupillary sphincter muscle that does that. So that, though, is a parasympathetic action. So it's not somatic because it's not skeletal muscle. The pupillary sphincter muscle is a smooth muscle, so it's parasympathetic fibers that are going to do that. Now, by the way, we do see the oculomotor nerve coming off basically like the junction between the midbrain and the pons, coming straight out through that superior orbital fissure, which is in your sphenoid bone, and then go into all this musculature. Now, there is one more muscle that the oculomotor nerve is going to go to that we got to know. And it's this muscle called the ciliary muscle. So it's this muscle called the ciliary muscle. The ciliary muscle adjusts the shape of the structure in your eye called the lens. So your eye has this thing called the lens, okay? And the ciliary muscle is going to either be relaxed, and if it's relaxed, the lens gets thin, and that's good for viewing things at a distance. So wherever you are right now, pick something that's like, 10 or 15 feet away at least, and look at it, and then kind of put your thumb in front of your eye. Maybe about like 6 inches in front of your eye. When you're looking at the thing, you're not really looking at your thumb. Your thumb is kind of blurry. But then if you switch to your thumb, whatever you were looking at in the back is now blurry and your thumb's in focus. And what's going on there? When you switch from distance to close vision, you are changing your lens. You are doing it with your ciliary muscle. So if you want close-up vision, your ciliary muscle fibers are going to contract. Your lens is going to get more roundish and thick, and you're going to be able to look up close. And your oculomotor nerve is what tells your ciliary muscle to contract. When you're looking at something far away, you are going to relax that muscle. The lens is going to get less round, less spherical. It's going to get thinner, which lets you look at things that are far away. Now, pretty much everybody at some point in your life, you're going to need to get some reading glasses because your lens starts to get too stiff, and you can't adjust the shape of it the way you used to. Thankfully, I am not there yet. I don't need reading glasses yet, so I'm mighty happy about that on this rainy day today. Okay, ciliary muscle, smooth muscle, so it's parasympathetic motor fibers that are going to control it. All right, so that was a bunch of muscles. We had 7 overall. Remember, we had the 4 extraocular muscles that we did, plus that eyelid muscle is 5, plus the pupillary sphincter muscle, plus the ciliary muscle. Awesome. All right, oculomotor is done. Now we got a much easier one, the trochlear nerve. The word trochlea means pulley. Remember that trochlea on your humerus that looked like a pulley? Well, there's another pulley-like structure just at the top of the orbit here. And the oculomotor nerve comes out of the dorsal midbrain. This is kind of weird. Not almost, all your other nerves are going to come out ventrally, but the trochlear nerve comes out dorsally, and it comes out, wraps around the midbrain, goes through that superior orbital fissure, and there it synapses on this muscle called the superior oblique. Remember the inferior oblique? We mentioned that a moment ago with the oculomotor nerve. The superior oblique muscle has this tendon that takes this detour through that little trochlear structure right there. And this muscle allows your eye to look basically down and out. So superior oblique was letting your eyeball look down and out. Now this is totally a motor nerve. This is a skeletal muscle here, so it is a somatic motor nerve. And hey, we're done number 4. Let's do number 5. Number 5, the trigeminal nerve. Trigeminal nerve. It's our first mixed nerve. So it's going to have both sensory and motor functions. Both sensory and motor functions, okay? There are 3 big branches, trigeminal, so 3 twins basically is what this word means. There are 3 big branches. The big branches are given with they've got like actual names and then also Roman numeral names. So there is V1, which is ophthalmic. So there's V1, which is ophthalmic. There is V2, and V2 is maxillary. V2 is maxillary, so this is the second branch. And then there is V3, which is mandibular. Notice how these guys are in reverse alphabetical order. Ophthalmic, maxillary, mandibular. Now, this is helpful, definitely, these designations, when we're thinking about the sensory function of this nerve. Most of your facial sensation is going to be done via this trigeminal nerve. So the trigeminal nerve is all about facial sensation, and you can see just how many different places this nerve's branches are going. Now, as far as the motor aspect, we're going to go to muscles of chewing. It's a better word for chewing. Better word for chewing is mastication. Better word for chewing is mastication. So muscles of mastication. So we got this nerve starting on the pons. We know it starts on the side of the pons here. And it's going to go out from there. It's going to go to lots of places. All right. Let's look at where we get sensation from. So the ophthalmic branch, as you can tell, is getting sensation from places like your forehead, the front of your scalp there, your nose, your cornea, which is that covering on your eye. Then your maxillary zone, so V1, V2 maxillary branch is getting more of the face, the cheek. Plus it's also getting kind of like the thing about a maxillary is upper jaw, right? So upper jaw structures, palate, gums, that sort of thing. Some of the nose as well. Then the last one, the mandibular branch, it's kind of like right along the mandible, then kind of up as well. And the mandibular branch is getting our lower jaw, so our lower teeth, our chin, part of the tongue as well. Now, the tongue there is not really for taste so much as it is for just like sensation, like if you were to pinch your tongue. So this is some of the sensory aspect of your trigeminal nerve function. If we're talking about the motor aspect, we got muscles of chewing, right? Muscles of mastication, like your masseter, which is on the side of your mandible. If you clench your jaw right now, clench your teeth together. I'm clenching my teeth together right now, and I can feel my masseter on the side of my jaw. If you touch your temple region, your temporal region, and you clench your jaw again, you can feel your temporalis muscle. And these are muscles of mastication. There are other ones as well. There are ones called the pterygoids. Remember how you had pterygoid processes on your sphenoid bone? The pterygoids. So other muscles of mastication. So with that, that is pretty much it for us for the trigeminal nerve. And now we're on the abducens nerve. And that name tells us what it's going to do. It's going to abduct something. It's going to abduct, in fact, your eyeball. Comes out of the dorsal, not the dorsal, the inferior pons here. Zips through that superior orbital fissure. Notice that all the nerves going through the orbital fissure have been eye movers, right? So oculomotor, trochlear, and now abducens. The abducens nerve, can't talk today. The abducens nerve goes to this muscle on the side of the eye called the lateral rectus. It's right here. They've actually cut it so you can see everything on the interior. This muscle's on the side of the eye. It's skeletal muscle, so it's going to be somatic fibers in here. And this guy, as its name implies, lets your eye look laterally. Makes perfect sense, right? Now, if this muscle is not working right or the nerve is not working right, the eyeball have a tendency to drift medially, like we see here in this picture. So another purely motor nerve here. This one's not that bad. And hey, we're definitely halfway done. And onward to number 7. Number 7 is the facial nerve. It is a mixed nerve as well. It is going to carry both sensory and motor signals. You can see it starting kind of just inferior to the pons right there. Comes out and is going to a lot of places. It is responsible for pretty much all your muscles of facial expression. So that's a somatic part right there. Muscles of facial expression. We'll look at some of those in a moment. It not only has somatic motor functions, but it's got parasympathetic ones too. It is going to your lacrimal gland, which is up here in your lateral orbit. Your lacrimal gland is your tear maker. So when you cry tears of joy, when this class is over, it's your lacrimal gland doing that, making those tears, and it's your facial nerve. It's parasympathetic fibers telling it to make those tears. Now, the lacrimal gland is not the only gland we're doing. The facial nerve is also going to do a pair of subs, the sublingual gland and the submandibular gland. Submandibular glands. There are 2 subs in a lake. Not a very good place to have submarines, I guess, but that's how I always remembered it. You had the 2 subs in a lake. Those are the glands of the facial nerve. The sublingual under the tongue, the submandibular just behind the mandible. These guys are going to be for saliva. These are salivary glands. All right. So there's also sensation. Sensation is going to be taste. And if you check it out here, we can actually see where the sensory nerves are here. They're in the anterior, the front 2/3 of the tongue. Front 2/3 of the tongue. Okay? So you got muscles of facial expression. We've got 2 subs in a lake, lacrimal gland, as well as the sublingual and submandibular gland. That's all the motor functions. Facial expression is somatic. Glands are parasympathetic. And the sensory function is taste from the anterior 2/3 of the tongue. All right, here we see some of the muscles of facial expression. like your zygomaticus muscle that lets you smile as you're studying this stuff. I'm sure you're smiling as you're listening to this. I'm sure you're using your zygomaticus major muscle because you are happy to learn all this stuff. Your orbicularis oris muscle, which goes around your lips, like if you were to say ooh and make a sort of ooh shape with your lips using your orbicularis oris. Your orbicularis oculi is another one, goes around your orbit. If you are squinting because you're laughing so hard anytime I make a joke, you're using your orbicularis oculi. So those are some of the muscles that are stimulated by your facial nerve. Sometimes the facial nerve just stops working. There's a situation called Bell's palsy where that happens and one side of the face will start to droop. So if that facial nerve on the right side stops working, because sometimes it's due to a viral infection, sometimes there can be other reasons, but then that side of the face will droop because that nerve is not telling those muscles to do their normal contraction. Okay, sweet. We're done with number 7. Number 8 is our last purely sensory one. There's only 3 purely sensory ones. Number 1, the olfactory. Number 2, the optic. And number 8, the vestibulocochlear nerve. Vestibulocochlear nerve starts kind of just below the pons here, above the medulla, zips out to these inner ear structures which are ensconced in the temporal bone. Now, there are actually 2 structures that this nerve is going to be involved with, and it has 2 branches. There's the vestibular part, which gets its own vestibular nerve, as well as the cochlear part, which has its own cochlear nerve. So the cochlea, this snail-looking thing, is where you have your hearing apparatus. It's where you're turning the mechanical movement of sound waves into electrical signals. So the cochlea is all about hearing. So the cochlear nerve will take those auditory signals back to the brain. Now, the vestibular part goes to this thing called the vestibule, as well as these structures you see here called the semicircular canals. And these guys are all about balance and head position. So if you were to tilt your head to the left, to the right, backward, forward, you are sloshing fluid in these guys. And the movement of fluid in turn stimulates nerve endings, which lets your brain know your head position. Also things like acceleration, deceleration are going on here as well. Very important for balance, the vestibular part of the vestibulocochlear nerve. Okay, fantastic. That was a quick one. I love it when they're quick and easy like that. Number 9, another mixed one. Glossopharyngeal, the tongue-throat nerve, the glossopharyngeal nerve. It is also coming out of that superior kind of medulla region here, zipping out of the skull and going to a variety of places. As far as its sensory function goes, it is doing taste from the back third of your tongue, as well as like just general sensation from your throat. Like if you swallow something that's like really too big, like you're super hungry and you eat half the Big Mac in one bite and you feel the swallowing of it in your throat, that's your glossopharyngeal nerve. So that's a sensory function. The other sensory function besides those 2 is actually kind of surprising. We see some arteries here. We got carotid arteries down here. Carotid arteries are carrying blood up to your brain and your face and your skull. And you actually need to monitor the oxygen level, the CO2 level, and the pressure and the pH. Well, I almost forgot one there. So oxygen, CO2, pressure, and pH of the blood in there. This is crucial for the homeostasis of those things. And the glossopharyngeal nerve is going to take that information back up to your brain. So actually, you're going to hit this again in the A&P2. When you're doing regulation of blood pressure, you're going to come back and talk about this pressure sensation. And also, when you regulate blood gas levels, blood pH, you'll talk about this guy again as well. So sensory is done. As far as motor part, there's one tiny little skeletal muscle called the stylopharyngeus. Helps kind of like move your throat when you're swallowing. And that's a somatic motor function for this guy. Then there's also a parasympathetic motor function in the parotid gland. That's your biggest salivary gland. If you have skinny cheeks, you can probably feel your parotid gland on the side of your mandibular ramus. It's your biggest salivary gland right there. All right. So I think that's it for the glossopharyngeal nerve. Yeah. Number 10. The vagus nerve. The vagus nerve is crazy. It's a mixed nerve. So we're just going to have both sensory and motor functions. The word vagus literally means like wanderer. One who wanders. And you can see, look at how many places it's going. It's the only one that gets down into the thoracic and abdominopelvic cavities. Earlier I said cranial nerves are all about the head and the neck. This dude is the exception. Now, whoops, didn't mean to hit that. We weren't even close to being done. With the vagus nerve, it is going to give you sensory information from your heart, your lungs, your abdominal organs. So simple example, think about your stomach, right? Sensation of your stomach stretching as you eat that delicious meal. If you stretch your stomach with your lunch, I literally just ate lunch before making this video. It was delicious. Thank you for asking. And my vagus nerve is what told me that my stomach was full. I won't even bore you with what I had for lunch, but it was so good. Where was I? We're also getting sensory information from the throat, the pharynx, from your ear canal, from your larynx, so your voice box there. Don't ever say voice box in anatomy class, so we always say larynx. So that's the sensory. As far as motor, as usual, there's somatic and there's parasympathetic. Notice how it's never sympathetic, right? It's always parasympathetic, okay? The somatic motor function is going to go to your pharynx and larynx. Love it when it rhymes. Pretty much all your swallowing muscles, except for that stylopharyngeus we mentioned a moment ago with the previous slide, pretty much all your pharyngeal muscles for swallowing controlled by your vagus nerve. Your laryngeal muscles for voice production, and if you were to adjust like the pitch of your voice, you're going to use laryngeal muscles for that too. That's your vagus nerve. Your parasympathetic function, though, we're going to go with the cardiac muscle in the heart. Now remember, parasympathetic is rest and digest. Remember that nickname we had for it? So it makes the heart rate go down. Vagus nerve also goes to smooth muscle in your lungs, relaxes your muscle in your airways, which dilates your airways. Goes to smooth muscle in your stomach and intestines, causing the smooth muscle there to contract. Remember, this is parasympathetic, so we're rest and digest. Plus, it's going to go cause your intestines and your pancreas and your liver and digestive organs like that, your stomach too, to secrete more secretions for proper digestion. All right, that, my friends, is it for the vagus. We got two more to do. We got the Accessory nerve, number 11. Then we got to do number 12. The accessory nerve is weird in that part of it starts from the cervical spinal cord from C1 to C5, and part of it starts from the brain. So some of it actually goes into the skull and then makes a U-turn and goes right back out. And this guy is totally a motor one. It is going to go to some skeletal muscles, so it's got somatic motor function. The major skeletal muscles that we're going to go to are going to be some throat muscles that we're not going to worry about their names, plus some muscles that move your head and your shoulders. So you got this big triangular-ish, more like diamond when you do both sides, muscle called the trapezius muscle. If you shrug your shoulders, like if I ask you a question about something in anatomy class and you're like, I don't know, and you shrug your shoulders when you say, I don't know, that shrugging shoulders action is your trapezius muscles. You get some heavy weights and you do some shrugs, some barbell or dumbbell shrugs, the next day you will have sore trapezius muscles. And it is your accessory nerve that does that. Now another muscle is this big anterior neck muscle. We've mentioned this guy before, the sternocleidomastoid. Runs from your sternum and your clavicle up to your mastoid process. If you rotate your head, you can probably feel it in the side of your neck or see it. If you look in a mirror, if you got your phone handy, see if you can find your sternocleidomastoid muscle. And that is also your accessory nerve. If I were to say to you, is this class way too hard? You would shake your head and say no. And you're shaking your head back and forth. You're using your sternocleidomastoids to do that. And it's your accessory nerve that's telling them to contract. Okay, awesome. We got one more to do. Gonna get out of here in under 40 minutes. Always exciting when we can be done in less than 40 minutes. Last but not least, number 12, the hypoglossal nerve. Hypoglossal nerve. It's a motor nerve, strictly motor. It is going to intrinsic muscles, extrinsic muscles of your tongue. Intrinsic muscles are the ones that are changing the shape of your tongue when you're talking. Extrinsic muscles are the ones that are more responsible for like sticking your tongue out, which I just did, but you can't see me, so it was a pointless gesture. Okay, awesome. Guys, we've done all 12. Yes! Should know their names, numbers, their functions as well. Now, I know we met some muscles this time. We're going to meet those muscles again, most of them at least, in the muscle labs we've got in the next couple weeks. I want to finish off by showing you a drawing of a person. I love this. This person has been drawn to show you where these cranial nerves are active. So look at the ears. The ears are made out of an 8 because it's vestibular-cochlear, which is inner ear structures, hearing and balance. We got number 1 here as the nose, because number 1 is the olfactory nerve. Make it the nose. The eye is actually number 2. Do you see that right there? With then these little numbers in it to help you figure out which muscles. Oh, look, there's a 4 up there. Above and at an angle, because that's for the superior oblique, which is a trochlear nerve. Awesome. Got a 12 down here for the tongue. Got a neck and or / torso with a 10 for the vagus, and 11 for like the shoulders. This is genius. Here's another one. This one's good too. All right. What I like about this one was, it was there on this one. I didn't even mention it on the previous one. It's easier to see here. But look at this 5 right here. The face has a big 5 on it, right? Because the trigeminal nerve is all about facial sensation. The head is made up of these 7s. Because the facial nerve is all about facial expression. So let's make a lot of the face out of the 7s. All right, draw me your best version that combines the best of these two. Draw me your best version. Email it to me. Email me that picture. That is your latest and greatest extra credit project. All right, I lied. We didn't get out of here under 40 minutes just because I got so excited and happy about these last 2 pictures, and my joyfulness extended today's video. So with that, guys, take care. Hope you're all doing well. We're getting to the end of this, I swear. Bye-bye.